President Obama has said the only way to cover everyone is through single-payer health care. He also said if we were starting from scratch, the way to go would be single-payer. Why not scrap our broken Wall Street greedy health insurance system, not provide health care, cut the cord on employee benefit health care that makes U.S. businesses less competitive and that disappears from the job bills, dispense with all the paperwork of multiple insurers the doctors hate, and go for the fairness and streamlined simplicity of improved Medicare for all. Congressman Conyers' bill, H.R. 676, which is a single-payer plan that actually saves money and does not require 1,000 pages to describe it.
How did I know that question? Two things. First of all, President Obama's comment. This bill that is on the House side, actually, according to the Congressional Budget Office, covers 97% of all Americans. The 3% it doesn't cover, according to the Congressional Budget Office, are those who choose not to be in it. And they're going to be fined a little bit because we want them to be able to pay for it. So it's not, I appreciate what the President said, but he's looking at probably a bunch of bills, and on the Senate side, that's a horse of a different color. There's about 5 horses running that race over there. And I don't mean that in a bad way, it's just different. And so this really is about as universal, I don't mean universal care as you can get, because I'm sure the same will happen on the other. Now, let's talk about universal health care, and I appreciate it on this. And I know I'm going to get feedback on this because I've had more meetings with single payers. Lonnie Frank here. Who else? So many people. How many people have had discussions with me on this? There's many here. Jim, here's where I sit on this. And I can tell you it's on the table. I can tell you it's out there. I want you to know right up front how I feel, what I believe in. And you need to know that from me. I believe from a representative. Because we're so far down the road. We know where we're headed in the general direction. And I agree with the way we're headed. There's 3 primary reasons as I work my way through why I believe that in the longer term you will have a longer term, better quality, more affordable if the plan that I talked about today works. The 3 are the following. First off, we tend to subsidize the single payer systems in other countries like England or Canada. On average, for example, they pay from the same pharmaceutical industry about 33% for their drugs that we pay. If they had to pay the full up cost that we do, it'd be a lot more burden, and you'd have to wonder, according to the budget, how long they could sustain it, is that example. So, to some degree, it's a little unfair playing field. Number 2 is, I come from the Navy, and I love it. And I kind of kid people. I just I love the Navy. I shouldn't say this, but if you can't, this is the best stuff you can, if you can't be in the Navy. But we canceled a ship about 6 weeks ago on the House Armed Services Committee that I'm on. It was a destroyer. For those Navy people here, you know how destroyers aren't that big. The cost of it, 7 years ago, was supposed to be $1.2 billion. When we canceled it, it was $5.5 billion a piece. Because there's no real competition. Only one shipyard, for example, builds an aircraft carrier. And so we kind of have to take what they give us. Now we can mandate that they only give us so much, and they say, well, I can't do it for that. To some degree, we're a single, not payer, we're a single buyer. And I have believed that ultimately competition, but transparency and fairness of that competition, like the public health and doing that with the minimum standards you have to do, best disciplines cost. The question is government accountable enough in setting up the right incentives? So I have found in the Navy, military, for example, we have $10 billion today in unused spare parts sitting on the shelves that will never be used, as the government accounting office says. We're just buying them. You tend to get into it almost automatically. Doesn't mean it can't be fixed. But the gentleman asking the question about Medicare wasn't totally wrong. It goes bankrupt in 2017. It's not single payer, but it's close to it. And so my take on it is government does do things well. And where people, or does things in certain areas, it does have to be involved in certain necessary areas. For example, I think Hubert Humphrey had it right. The moral test of government is how well it takes care of those in the dawn of life, the children, S-chip. He didn't say S-chip, I'm saying. Those in the twilight of life, the sick, disabled, the handicapped, Medicaid. Those in the twilight of life, the seniors, Medicare. But on the whole, except that transition in life, when people are having a tough time, I feel that in the longer term, competition that will find the new innovative drug and reduce people out of the selfish use. So if it's managed in the right way, like inducements of can best discipline cost and quality in the future. That's what I believe, and I'm happy to listen on that because I think we have at least two single payers